when the student comes in to meet with you, or if you see a student in class, what's actually happening with that student in the moment? What are you noticing? So you all have a paper that's called the Inventory of Concerns. It should be double-sided. Forget the copies, the back side is upside down. So with this inventory, it's kind of like a guide. You don't really have to use it when you're sitting with the student. It's not really expected that you sit with them and you like interview them and ask them all the questions on the list to start checking things off. It's really just for you, for your background knowledge. And what you can do is, as you're having a conversation with the student, maybe go back to that inventory of concerns a little bit later and then check off some of the things that came up in the conversation. Make sense? So in terms of data review, these are things that you want to take into consideration when you're meeting with the student, but also maybe after you met with the student. So are there any current ways that you will document your interactions with students at all? Do you have to write down any interactions with students at all? No? Okay. So it might be important for you, just for the future, to keep some informal records of meeting with students. And it could be simple, just pen and paper, the date, the student's name, and whatever the issue was. Just so you have an idea of what was going on with the student, because sometimes you come across a lot of students, and you might forget what's going on with each particular one. So that way it can kind of jog your memory. If you have to meet with them more than once, you can look back at your notes and say, okay, I remember this is the thing that we talked about the last time. Make sense? Okay. And so also with data review, there can be transcripts that you might need to look at to get a past educational history of the student, maybe see the attendance records and their grades, how they were doing in other classes as well, besides yours. And then with the interview, it's not really an interview, it's just a conversation with the student. You want to keep in mind nonverbal cues. So it's not just about what they're saying, it's also about what they're not saying, right? So for example, a student may be looking really, really upset, but then if you ask them, they'll say everything is fine. But you can tell by looking at their face that everything is not fine, right? So then you might want to ask them a couple more questions, maybe pull them to the side, talk a little bit in private and say, you know, I'm really concerned because you look like you want to cry or something. Is there anything that's on your mind? Is there someone that maybe I could suggest that you speak to if you don't feel comfortable speaking to me? But I do notice that you look a little bit upset, even though you're telling me that you're fine. Make sense? So with the levels of risk, again, going back to the inventory of concerns, these are just general guidelines. This is not something that's set in stone that we're saying you have to do X, Y, and Z. These are just ideas and principles for you to kind of follow. We're going to go over different levels, and these are all just intended to reduce any kind of confusion, but not to completely eliminate it, because this is not something where you can look at the inventory of concerns and maybe check off 4 or 5 things and say, okay, I know exactly what's wrong with the student, and I know exactly what to do next. It's not like that. It's just to give you an idea of some next steps. Okay? And there could be some overlap in some of the concerns that you check off too. And that's especially in cases with a level 2 or a level 3. And we're going to get into each of the levels. We're going to get into each of the levels now and explain all of them to you. Okay? So it ranges from low risk to emergency imminent risk. And we'll go through each one of those for you. So with low risk, it's pretty much like typical problems that a student might be dealing with. So for example, freshman student might come in, maybe they're crying, maybe they're worrying. It could be something like homesickness, maybe it's their first time living away from home, living on campus. Maybe they're a little bit concerned about their classes because in high school they were doing really well. They were the big fish in high school, and now they come to college and now they're the little fish, and so they're really worried. But these are just normal developmental concerns. It would be expected for someone to be concerned about those types of issues, right? So if you go to your inventory of concerns after you've met with a student, maybe you would probably check off crying and worrying, for example, right? And you would probably know from the conversation that you have with the student that they haven't had any prior history of going to mental health counseling. They haven't really had any issues with substance use. It's just pretty much they're homesick and they're just worried about doing well in their classes. Okay? So what you would look for with that student is any nonverbal cues like I was talking about before. So if they look like they're tearful, if they look like they were crying, if you ask them how they're doing and they're like, oh, I'm doing okay, but physically it doesn't look like they're doing okay, those are kinds of things that you will go back later and check off on the inventory of concerns. And then for the data review, when you're having a conversation with the person, maybe you notice that they have a support system in place. Maybe they're really good friends with their roommate. Maybe they even knew the roommate from high school and that's why they're rooming together. Their family is close with them. They keep in regular contact with them. Or maybe they are part of a student organization or something, or they have regular communication with their advisor. So you see that they have a lot of different people, either on campus or off campus, that they can connect with if they need help with something. So that's what makes this kind of a low risk, something where you can just maybe remind them of some of the things that they've done for themselves before to make themselves feel better or worry less, and then they will be fine to go on their way. Make sense? Any questions so far? Okay, go to the next one. So if moderate risk is going up a little higher in the level of concern now, so maybe with this same student, they were crying, they were worrying, but now the worrying is a little bit more, right? So maybe with this student, they're getting really anxious. Maybe they get anxious around exam time. Maybe they get anxious when they have to do a class presentation. So maybe on those days when they have to do a presentation, they might skip class. Right? So now you're starting to see they have some absences, right? Going back to looking at a transcript or maybe getting some information from another professor. You'll see that they have a little bit more things that you can check off on the inventory of concerns, right? Maybe they have some minor substance use issues, maybe smoking marijuana here and there, you know. Maybe they have some financial concerns about financial aid, right? But they have some coping strategies in place, but maybe they can use a few more tools in their toolkit. Okay, make sense? Okay. So you can go to the next one now.
So now we're talking about level 3. It's a little bit more severe than level 2. So now the behaviors are a little bit more significant. So they may be cutting, and by cutting, I'm not talking about cutting class, okay? Cutting is like they're using, like, say, razor or some kind of sharp object to cut themselves as a self-injurious behavior, or they could be like burning. And then also they're getting into verbal fights a lot, they're feeling very agitated, maybe getting into physical fights as well, and then sometimes they will have like a significant substance use, or increase, and a lot of times they will tell you that they're feeling very, very hopeless, and they will say that, you know, I feel like I'm in a deep hole and I can't get out, and I just don't see the future. It's just like so black to me. And so that's our level 3. So what you're going to notice that, or they will notice is physically they're gonna have some changes. So they will have a very hard time going to sleep, or they will have to, or maybe they're sleeping too much, or not sleeping enough, or maybe they're not eating. And they will tell you that because I'm feeling really, really depressed, I just don't have the appetite, and I really haven't been having a good meal for like a week, and I have lost like maybe 5 pounds or 10 pounds. And then also these students will probably have a past mental health history, and they probably have seen a therapist or even a psychiatrist in the past, let's say high school or coming to college, and or they may have a very heavy substance use or alcohol use history.